Today we're reporting one new case of COVID-19, which brings our total number of confirmed cases to 1,058. The case is in Eastern Zone, and there's somebody who was exposure was as part of their travel outside of the province. Fortunately, this individual followed public health protocol and was in self-isolation from the time they returned to the province, and so had minimal exposure at the time they may have been infectious. As I reported yesterday, we have one long-term care home with active cases of COVID-19, which is Northwood, and we're now down to 3 residents and 2 staff who have active cases, so we can continue to make progress at Northwood as well. Our QE2 lab continues to work around the clock, and yesterday they processed 639 tests. We currently have 3 individuals in hospital. One of those is in ICU, individuals with COVID-19. We now have 993 people who have a COVID-19 infection but have now been considered recovered. And we've had 43,340 Nova Scotians who have been tested and received negative results. As I said yesterday, the Nova Scotia Health Authority started offering Nova Scotians the option of having a negative test result sent to them by email. And I was updated earlier today, and that a number of people have already taken advantage of this and signed up for that option. We know that people are anxious to get their test results, so an email is a good way to get it as quickly as possible. But regardless, even if you choose to still have your result phoned to you, you'll get it within generally 48 to 72 hours. And just a reminder that anybody with a positive result will always receive a phone call and further directions from public health. I'm hearing lots of good things, and sort of seeing the protocols that are coming in for reopening and recovery. That certainly a lot of good work is happening, and I know lots of Nova Scotians are looking forward to Friday to potentially enjoy a meal or just simply an evening outside of their home. But I want to remind people that make sure they have appropriate expectations of that. Your experience will be quite a bit different, whether you're going to a restaurant, whether you're going to a hair salon, whether you continue to go to shopping. That your experience will look different. Certainly in restaurants, we know that you can expect tables will be further apart so they can maintain that 6-foot social distancing. And there's other public health measures that support better hand washing, controlling how people move around in a restaurant or a bar space, and limitations on the type of activities that can happen in terms of entertainment and dancing. One thing I want to make clear is that certainly people have to understand that the physical distancing requirements and the rules around household bubbles and family household bubbles haven't changed, and they pertain to restaurants and bars like everywhere else. So while people may be at tables up to groups of 10, and then unless they can be separated by 6 feet or while they're at that single table, which is not likely, they have to be people from the same household or household bubble. We're not yet ready to have people from multiple different households come together, sit at a single table in a restaurant. So if you're making plans to go out, you have to make sure that it's done with people, if you're going to sit at the same table, within your household or within your household bubble. You could certainly go with other people and sit at different tables and say hello to each other from 6 feet apart, but who you sit with at the single table, it needs to be within your household or your household bubble. So I think, I want to make sure people understand that, because there's certainly been some questions about that and perhaps a misunderstanding on this. So planning who you go out with and how you go out needs to be more thoughtful, and is a key part of our moving forward and our living with COVID. When you're going out for other things, whether it's other recreation or cultural opportunities, whether you're just going out for shopping, it's important you think about who you're going going with, and where the setting that you're going to be meeting at, and what particular rules might be associated around that specific setting. That it's important that you understand that as you go out, there's going to be lots of things that are going to be helping you maintain a social distance, helping you wash your hands, and we really ask Nova Scotians to follow those directions. We're worked very hard with our business partners, with our community-based partners, all of whom are creating environments that will support the necessary public health requirements. But at the end of the day, there's an obligation and a need for all Nova Scotians to participate and follow those public health requirements that are being put in place in all our kind of public spaces and retail and business places. And one of the critical things is that people need to understand that if you're not feeling well, then that is not the time to go out. You may have COVID-19, and if you meet any of the symptoms, or if you're not sure, do the 811 online assessment. But if you're not feeling well, it's critically important that you not go out and potentially expose others to COVID-19. A last reminder, again, is about because of some of these rules and the restrictions around numbers and how many people can go into a store or into a restaurant at any given time, you need to expect that things will take a little longer. There may be lineups that respect social distance. You may have to, just be a bit more patient as you're moving around, for instance, a store environment. But all this is in place to keep you safe and to keep your fellow Nova Scotians safe. So again, asking people to be patient, to think about others and how you work together collectively, whatever setting you're in, to keep each other safe. I recognize that it's going to take some time for everybody to learn and adapt to this, but if we're patient with each other, if we work together, we can move ahead and minimize the chance of COVID-19 coming back while we all work together to respect the necessary public health requirements.